Hello, this is Lorraine Brown.
Hi, Miss Brown. Enid, how are you?
Hi, Enid.
Miss Leopold is going to be a bit late this evening, so.
Hello, everyone.
Oh, Miss Leopold, you're here. Great.
Good evening. I'm on another call, on another Zoom call, emergency call with Assembly Member Zimmerman, and I'm there, I'm listening. But as soon as I finish doing my presentation with them, I'll be jumping back on. So I just want to say thanks for everyone. Ms. Brown, thank you so much for being here. It's always a pleasure to see you. And
Yes.
Enid would be running the meeting for us whilst whilst I'm on the other side. So I just thank you, Enid. I just want to say hello to each and every one of you. Hope you had a wonderful day, and it's always good to see you. And I know that Ms. Brown has been doing such great and fantastic work with OBH, and I'm hoping that the information that she gave to us this evening, that it will be well received, and then we'll give her on our invited intention. So although since they are not ready for me as yet, so I'm just going to ask one question. Did you accomplish what you wanted to for the day? That's my icebreaker question. Did you accomplish what you set out for the day?
Well, I'll try to answer that. And if our conversation this evening is a productive one, then I will leave here. I'll leave my office very satisfied that I've accomplished what I had intended to do today.
Wonderful.
Thank you. That's a great question.
Anybody else wish to answer?
I just want to say hello to everyone. I'm sorry for missing the last meeting, and hi everyone.
Hi.
I just want to say hello to everyone, and I had no idea that the famous Miss Brown would be on our humble Zoom. This is your old email buddy, Yosef.
Yosef, yes.
Wonderful, wonderful.
Well, Miss Fran, this is Enid. Can you see me on camera? Because if you can, then I've accomplished my goal for today. It looks like it looks like I'm off, but my camera's on. I just want to make sure.
Yeah, we can see you. We can hear you, but we can't see you.
Okay, so that's a problem. Let me see if I can fix it. Okay, thanks.
Yeah, so I think Ms. Brown is the only one who answered the question. I didn't hear from anybody else. I will answer that I accomplished maybe 60% of what I wanted, but I'm truly satisfied that I was able to accomplish 60%. So I'm grateful.
And also you're multitasking.
Yes, I am. I am. I am. This was something the commissioner threw in my lap today, so I couldn't say no, so I have to represent the agency. So anyone wants to share? Did you accomplish what what did you set out for the day? Go ahead. Go ahead. You're muted. You're muted.
How's this, a little better?
Yep.
Hi, good evening, everybody. I'm about 80% accomplished right now, and I'm hoping that by bedtime I'll be able to accomplish everything I set out for the day.
I like that.
But still plenty of time in the day, a lot to do. But God will succeed. It's great question.
Anybody want to share? Okay, since no one wants to share, anyone else wants to share, so we'll move on, and I will pass it over to let me see.
Yeah, you gotta make sure the media comes on. You're clicking through that.
Okay, so that is it. So we did we are here. So since I think we may have persons who are joining us for the first time. So I will ask you to introduce yourself, and I will start first so that I don't have to cut off. My name is Francesca Leopold. I'm second vice chair for community Board 9, and I'm also the chair for Health and Social Services. And again, I say welcome. I'm so sorry that I have to split myself, but it happens sometimes. But when you have capable, those persons on the committee, I know they are capable people. So the days that I can be there to run the meeting, I will call on any one of you to run the meeting. As long as you have the agenda, you will be able to run the meeting. It is our meeting, not my meeting. It's our platform. So I'll be ready anytime that I could just call you and say, hey, just pick up the bottle and go with it. So thank you again for coming. And I'm gonna pass it on to Sandra. Please introduce yourself. And then as Sandra, then you can popcorn it and pass it on to somebody else.
Okay. Good evening, everyone. My name is Sandra Roberson. I'm a resident of Community Board 9. This is my first time attending the Health and Social Services meeting, and I have an ask of this committee. I don't know, since this is my first time attending, at what point I should bring it to you or just introduce myself at this point. So someone maybe would want to tell me the process. So I guess later on, I would bring up the issue that I have that I would like the committee to consider. Okay, I can't hear you, Mr. Leopold.
I'm sorry for that, Ms. Robertson. My name is Mia Hilton. I'm the Assistant District Manager here at Brooklyn Community Board 9, and that is correct. We do have a scheduled presentation by Ms. Brown, and then after that presentation and some Q&A, there will be time for community concerns and inquiries and everything of the like.
Okay, great. Thank you.
Sure thing.
You can pass it on. You can pass it on, Sandra, to somebody else.
Okay, I'm not sure who am I passing it on to. Mr. Alpert, did you want to say anything?
Not off the bat. I'm kind of just waiting, ready to listen.
Okay,
But I guess when the time is right, I have a proposed idea for programming for local elderly over the next few months. When the time is right, of course.
okay.
I like that. Thank you. I like that. Albert, pass it on to somebody else. Whoever is on your screen, just pass it on to them so they can introduce themselves.
Diane A. Smith, it's nice to meet you.
Good
Sorry to
evening.
put you on the
Nice to meet
spot.
you as well, Mr. Albert. Yes, my name is Diane A. Smith. I'm a community ambassador with the East Flatbush Community Partnership. And you, Community Board 9, your zip codes fall into our partnerships catchment area. So I just wanted to find out what was going on with community events and community activities for the community board. I do have an event I want to share, but I can do that when you do the open floor segment of this event. And Mr. Albert, what I'm sharing will probably be of interest to you because it's for older. It's something we're doing for older adults to show our appreciation. Okay. And I will pass it to Menachem Shoma. I'm sorry if I butchered your name. Forgive me.
It's all right.
Okay.
It's happened. Hey everyone, good evening. It's good to see you all. I'm here to listen tonight, here to support. And support all the wonderful things this group is doing. I am going to pass it on to Francisca Leopold.
Who did you pass it on to?
Yours, Francisca, it's you. You're up.
Yeah, so I'm gonna pass it on to Nyasha.
Hi, everyone. Good night. Nice to see everyone that checked in last meeting and everyone that's here and new faces. I'm looking forward to hearing some great presentations from Ms. Brown and anyone else who might be presenting tonight. Yeah, and I would pass it on to Deborah.
not to,
Who did you pass it on to?
Deborah.
but in the same token,
Deborah?
and we can't tell because I've seen very quick turnarounds and I've seen very.
I don't know if there's a Deborah there, but Diane, can you pull it up and then you could pass it on to Enid?
I guess happens.
There's a Deborah, if not Dion Misab, you can go ahead.
Hi, yes, good afternoon, well, good evening, everyone. My name is Doyen Saab. I was made secretary last meeting. This is my second meeting as a community member. I'm really excited to hear the new ideas and proposals that folks have in the room tonight, and I'm excited for our presentation from Ms. Brown. I'll pass it on to, did Yosef go?
I think Deborah
I
may
think
have,
Joseph went already too.
yeah, I think Deborah's the last person. I'm gonna ask her to.
I'm not sure they're there.
Okay.
Enid, the platform is you and Mia. So I need that Enid, if no one else is, like I can't see everybody. So if everybody has one, so I'm gonna pass it over to Enid.
Good evening, everyone. I'm so sorry you can't see me because I have an issue with my camera. But my name is Enid Dillard. I'm the Senior Director of Marketing and Communications for One Brooklyn Health. And as always, it's a pleasure to be with the group. I have been a member of this group for going on 3 years now, and it's always my pleasure to work with Ms. Leopold and all of the members. This evening, I would like to introduce Ms. Lorraine Brown, the CEO of One Brooklyn Health. This evening, she's going to be sharing with us the integration and transformation plans happening at Kingsbrook Jewish Medical Center. Ms. Brown, welcome.
Thank you so much, Enid, and thank you very much, community board members. And some of you I know and some I don't, but it's always a pleasure to come in front of the community planning boards and particularly to hear what's going on in the various community board and hearing from the community. My reason for addressing you all this evening is really to provide an update as to the work that we're doing on the Kingsbrook campus. Some of you may know that we have been involved in a transformation plan for the last, I would say, several years. A couple of years, it got somewhat postponed because of the 100-year pandemic in terms of COVID. But back in 2017, a plan had been laid out, frankly, by the state as to the transformation of our Kingsbrook campus from an acute care or hospital inpatient campus to more of an ambulatory care campus or medical village, and a campus focused on post-acute care. And as part of that transformation, we were also looking to rebuild or renovate several buildings on our campus and partner with the New York State Housing and Community Renewal Agency for the development of more than 400 units of housing on the Kingsbrook campus. Tonight, I'm really going to talk not so much about the housing development, because that is being undertaken by the New York State Housing and Community Agency, and also Monadnock, which is the developer for the campus. But I'm going to really focus on the changes that we are making in terms of the healthcare services to be provided on the Kingsbrook campus. And first, let me say that we continue to enhance, improve, expand our services in terms of long-term care. We have committed to creating programming for pediatric children, who have special needs and need long-term care and who cannot reside at home, and as well as for creating services for young adults. In fact, children who become young adults and who continue to need long-term nursing home support. And in fact, we will be putting in a certificate of need in the next month or so to add additional beds in our Rutland nursing home for young adults. And we're excited about that. I should emphasize that that body of work has essentially resulted in our being able to bring children back who were placed outside of New York City, outside of Brooklyn, and outside of New York State in some instances, back home to get their long-term care services closer to their families. We're excited about that. And in fact, our executive director for the campus likes to say that we are a referral site for services, up as far up to Albany, to New Jersey and other counties in between in terms of New York State. And that will become a major programmatic center of excellence for One Brooklyn, our Rutland nursing home, serving individuals, children and young adults and older adults who have special needs. So that's one area of focus in which we're making significant investment. The other investment that we're making is to become an outpatient campus. And what do I mean by that? We are actually going to be building a brand new 2-story, 20,000 square foot medical village on the campus. We had originally envisioned that we would renovate one of the existing buildings on the campus, but in doing so, we actually did in the interior demolition and discovered that the cost of doing cosmetic improvements would be frankly very expensive, and it would not allow us, even at the cost that was being projected, to essentially have a long-term functioning building because of all of the infrastructure replacements that would be needed in what we were envisioning using, which is the Brigger building. And so with that determination, we've discerned that it would be much better to use the $40 million that we were going to spend in, as I like to say, making a silk purse out of a sow's ear in an old building, and that would eventually need a new roof and other types of infrastructure. And actually build from the ground up. So we intend to construct a 2-story, 20,000 square foot ambulatory care building on the parking lot, literally, of the Brigger building. And so in the coming months, you will begin to see some progress made on that parking lot for the new construction of an ambulatory care building. We have hired the architects. We are doing now all of the necessary surveys that needs to be done. But we've pivoted from using the Brigger building and now looking to develop our ambulatory care footprint on a new location. In fact, that'll be closer to street access, et cetera. And most importantly, it will be a brand new building with all new and brand new infrastructure. In addition, as part of the development of housing that I refer to, one of the affordable housing development projects with the New York State Housing and Community Renewal Agency happens to be going to be built on Utica Avenue, or our Utica Avenue parking lot. And with the development of that housing, and they will be closing sometime later this month, early December, and with 18-month to 2-year construction, we will get 10,000 square feet in this new housing structure for the provision of ambulatory care. So what we will end up with in the next 2 years are 2 very new, and I'm so excited about this, 2 very new spaces, 20,000 square feet in a building that we will be constructing, and 10,000 square feet as part of the development of a couple of hundred, I believe it's of affordable housing units on Utica Avenue. In those ambulatory care buildings will be most of the outpatient services that we are currently providing now, which is scattered throughout old buildings and throughout the Kingsbrook campus. And so they will all be consolidated into these brand new spaces. We are also exploring services that we are not providing on that campus, such as an infusion center. And that still needs to be determined, but that's part of the conversation as to how we build out, how we design the 20,000 and the 10,000 square feet respectively. So that's all good news and different than what I may have presented or has been presented in the past, because what we were looking at was how do we retrofit old existing buildings. And we've learned not only as, you know, you don't find certain things out until you begin to break into walls in older buildings, but we've also learned, given the increase in construction costs, that sometimes it's just less expensive and much more realistic to actually build from scratch. Now, with that investment also comes some things that we will no longer be doing on the campus. And I mentioned back in 2017, when the Brooklyn study that was conducted or commissioned by the state, when it recommended that the Kingsbrook campus transition or evolve from a inpatient or hospital-based campus to a campus focused on long-term care and ambulatory care and supporting housing, that meant that we would no longer provide inpatient services. And you may remember that we actually closed inpatient medical surgical beds in 21. And we also, summer of 21. And in the fall, the latter part of 21, we ceased providing psychiatric inpatient services on that campus. I should say that no one has gone unserved because of those changes. In fact, in both instances, individuals who need to be admitted to acute hospitals were actually admitted within the rest of One Brooklyn, principally, and or depending upon the patient's choice or their doctor's choice, transferred and admitted to other hospitals within Brooklyn. But the lion's share of patients who required admission went to either Interfaith or Brookdale. And that has worked well. People who have come to the emergency department at Kingsbrook did not have to stop and sit in another emergency department at either Interfaith or Brookdale, but they were admitted directly to their inpatient service. We also have partnered with our hospitals in and around Kingsbrook, both Kings County Hospital and the University Hospital, to ensure that we're coordinating our services and that there's not been any untoward or how should I say it, overwhelming impact by those changes that we've made over the last couple of years. Moving forward, we intend to no longer provide inpatient rehabilitation services. Right now, we have a 40-bed acute rehab inpatient unit. Usually that 40-bed unit has anywhere between 15 and 18 patients in it. We will cease providing, let me just take a little bit of water. We will cease providing that service at the end of November. And in the same spirit of our coordinating with our other hospitals in not only in the One Brooklyn system, but in Brooklyn, we have communicated what our plans are, and each of the hospitals, Kings County, Brooklyn Hospital, and others have mentioned that they have capacity for inpatient rehabilitation. I should mention that the changes that the federal government has promulgated as well as changes in terms of how services, rehabilitation services are provided these days. Most of it's provided on an outpatient basis, some in-home. So when folks are coming out of an acute care situation and they need rehab, a lot of the rehabilitation, physical therapy, et cetera, is now done on an outpatient or an in-home basis. The other change that we will be making is that we will be no longer providing an emergency department. We had, when we closed the inpatient services on the Kingsbrook campus, we had maintained the emergency department. And what we have learned in the last 3 years or so is that on an ongoing basis, we may have 1 to 2 people an hour who come into either walking or brought by ambulance to the Kingsbrook ED. That's compared to 50 or so an hour in terms of your average hospital emergency department. Although the folks who've come there, some of whom have needed to be admitted to hospitals, and I mentioned that they would get, they have gotten direct inpatient admission to the sister hospitals at Interfaith and Brookdale and other hospitals of their choice. That level of activity in an emergency department where we have to spend significant amounts of funding to run a 24-hour emergency, 24-hour, 7-day-a-week emergency department does, from a financial perspective, as well as a service delivery perspective, given the lack of resources that we have and the need for us to be prudent in using the resources that we have, does not make sense. We have communicated our intentions to Kings County Hospital Center, as well as the University Hospital, because they are, as you all know, around the corner or a stone's throw from Kingsbrook. And neither of the hospital leadership has said that are no longer providing the emergency department services on the Kingsbrook campus. Neither of them has said that that would create any significant problems or concerns. I should also say that we have a hyperbaric chamber that's on the campus. Well, actually, we had 3 chambers, one of which is operational. We will no longer be operating that hyperbaric chamber. That's used for wound care and other types of support. I mentioned the inpatient rehabilitation unit. We also will no longer be providing ambulatory surgery. Now, we closed our ORs in the summer of 22, and that was because we had significant environmental problems and for which we had no funding. And what we have done is to expand the ambulatory care surgery capacity at Interfaith, where we have extended hours during the week so that the surgeons who were using the Kingsbrook campus have had the opportunity to use the Interfaith campus. And again, we've not had any complaints or concerns on the part of the surgeons or patients, and we've been able to accommodate their needs within our system. If you don't have an emergency department, you don't need a 24-hour pharmacy, you don't need a 24-hour lab. And so we will be making changes for those with regards to those ancillary services, but still providing those pharmacy and clinical laboratory services for our outpatient programs or services that we will continue to provide, as well, of course, of our nursing home. And we also have, we have provided chronic dialysis. We have 14 chairs in a building at the Kingsbrook campus. In those 14 chairs, most of the patients who receive dialysis actually come from our Rutland nursing home, but we do have people from the community who are in need of dialysis. So we're doing 2 things. In terms of the 36 or so nursing home residents who receive dialysis, we're actually going to be providing dialysis inside of the nursing home, running 4 shifts with our staff to make sure that our nursing home residents receive the dialysis that they need. And in the case of the community individuals who are receiving dialysis on the campus, we are working with other community-based dialysis centers and those patients in there making selections as to where they would go for their continued dialysizing. All of these changes we will be making, and we'd hope to have effective the end of November. We are working very, very closely with our labor partners. We have staff who are impacted, of course, by these changes, actually more than 300 staff. And for all of the unionized staff who are impacted by these changes, we have a position for them either on the campus as it relates to the nursing home, but mostly at our other One Brooklyn sites, including our ambulatory care sites, but also mostly our Brookdale Hospital and Interfaith Medical Center. And literally, we're working with the 1199 and NISNA and matching vacant positions that we've been holding and filling with overtime and part-timers or temporary staff, matching those positions with the functions, the skill sets of the staff who have been working at Kingsbrook, so they can again be deployed within One Brooklyn. I'm going to pause there because I know I've said a lot, but I want to just make sure that you all appreciate that this is part of a multi-year strategy and what we will end up with what was envisioned for the Kingsbrook campus. It has been a long time coming. In the middle of the plan was COVID, and we had a cyber attack, and everything that could have happened did happen. But we are continuing to work at pace with our labor partners, and we just want to make sure that we keep the community partners apprised. I should also say that I have had conversations with our local legislators, our assembly members, our Senate, state Senate members whose districts Kingsbrook serves, and to keep them abreast as to our plans.
Does anyone have any questions for Ms. Brown at this time? No questions for Ms. Brown, anyone?
I have a question. So who is the, and I'm sorry if you've already said this, but who are the affordable 400 units? What's the eligibility to?
Again, One Brooklyn is not, we're not in charge of the housing development. What we've done is just afford the housing developers to be able to access parcels of our parking lot in the case of one of the units, and other parcels on the campus of buildings that we don't use or land that we're not using. But what I understand for the first phase, which is the housing that's being developed on the Utica Avenue parking lot, it's affordable, excuse me, so, for a mix of individuals, seniors, as well as individuals with special needs, folks who are also coming out of the shelter system, but it's a mix of individuals. And my understanding is that it's, I think, no more than 60% of the average median income, but many of the individuals will make less than 60% of AMI. And I also believe that, again, they haven't even broken ground yet, but I do believe that they will engage in a process of a lottery system and communication with the neighborhood when they get to that juncture. I should also add that in addition to the 10,000 square feet of healthcare space that's being built as part of that housing development, they're building a supermarket, and they will also build out community space that will be available for community-based organizations to use.
Okay. Thank you, Ms. Brown. Thank you for the presentation. Sorry, I forgot to raise my hand.
That's okay. There's a question from Yosef. Yosef, please unmute and ask your question.
Sure. Hi, Director Brown. Two questions. Number one, if you could speak for a second about I saw recently that you guys added psychiatric beds. Did I get that correct?
Yes, yes.
And
but-
number two is a
Okay.
more general question. Why does the borough of Brooklyn not have a burn unit? Everyone has to go to Staten Island or Manhattan. I'm sure that you yourself obviously would want to have one. I'm just curious, what's the deal with that?
Okay, so I'll answer the first question you asked. So, and I'm glad you did, because I failed to mention, Joseph, that we're doing major renovations at Interfaith and Brookdale. And one important part of those renovations is our psychiatric inpatient capacity. At Interfaith so far, we've totally renovated 2 out of 4 units that we will eventually have. And we are, those 2 units are 24 beds, excuse me, apiece. And then we are literally starting the renovations for 2 units at the same time of another 24 beds. So we'll end up with 96 psychiatric inpatient beds at Interfaith alone. We are completing renovations of inpatient capacity at Brookdale. And I believe that we'll end up with about 62 behavioral health or psychiatric inpatient units at Brookdale. And in addition, at Interfaith, we're doing renovations to our substance use treatment units as well. I should also add that both Brookdale and Interfaith are undergoing renovations for brand new emergency departments. And at both, an important component of the emergency department renovation projects are psychiatric emergency departments. And that will also include some additional CPEP capacity, which is the program model where folks can be screened and served for up to 72 hours in the emergency before, and hopefully without having to be admitted for an inpatient stay. So we're creating additional capacity in all areas of behavioral health. So thank you so much for asking that question. Now, on the burn center question, what I cannot say to you that I would personally want there to be a burn center in Brooklyn. What I do remember in my other life, when I worked for Health and Hospitals, that was a perennial question, Joseph. And it becomes a question, as we're really, frankly, with the State Department of Health, of how and how does one invest in a regional service, particularly such as a burn center, because as you can imagine, there needs to be a critical mass of different expertise and a real specialized team to appropriately treat victims of burns. So that's really a question that we should be asking to the policymakers, and us also as to where it should be. But as you well know, Brooklyn is a big borough, and in any other state, it'd be a city in itself. So it's a good question.
Thank you, and it's an honor to hear from people. Don't realize that you're one of the top 50 healthcare experts in the whole America. I don't think people grasp that yet.
Thank you.
Stay safe. Thank you.
I'm just old, that's all.
I'm older than you.
We have another question from Menachem. Please unmute your mic and ask your question.
Hi, thanks so much for that answer. And a lot of Joseph's questions really addressed the questions I was going to ask. But to change it a bit from there, I'm wondering what is being done to increase the outpatient psych and counseling services, because as a mental health counselor in the community, I've seen that there's a severe shortage and people are, have to go to Westchester very often for services, and it could be months of wait time before you can get a counseling appointment, even in very acute scenarios.
So I would agree with you that there is a shortage for outpatient mental health services in Brooklyn and frankly in the entire state. One of the things that we're doing is we're expanding, and this is a relatively new initiative. We've applied to be a center of excellence for behavioral health with 3 of the managed care plans. And what that will they will provide us with some funding so that we can ensure that someone being discharged from an inpatient unit will be able to get into outpatient services quickly. And to your point, and now what that will entail is, of course, the recruitment and hiring of outpatient therapists. And that's one of the challenges. I can't speak for other organizations, but I know that's a big challenge that we have of literally recruiting not just psychiatrists, but psychologists and clinical clinical social workers, et cetera. But we are looking to take advantage of any funding source that will enable us to expand outpatient mental health services in the One Brooklyn system.
I'm so glad to hear that that's a priority on your end as well. So thank you for that.
Absolutely, absolutely.
It's a
Because
pleasure
one of the
meeting you.
things, yeah, it's a pleasure to meet you, Malcolm. And sometimes people will say, Lorraine, you sometimes talk about things that'll put you out of business. And I say, and if it's something that in fact can be done outside of a hospital setting, then I'm all for it. And one of the issues for us is the need for there to be an expansion of ambulatory care services, of medical or general health outpatient services, as well as mental health services. And the more we can do that, hopefully the more we can prevent people from unnecessarily using emergency departments or inpatient services. That's not to say that there are not times when people need to be admitted to hospitals, but to really develop a system where we can create the levels of support that people and their families need.
I see Doyen, your hand is up. Please unmute your mic and ask your question.
Yes, so in that same tone, are you all also considering providing harm reduction services?
Well, actually, One Brooklyn at Interfaith, we are a significant provider of substance use treatment services, both methadone, as well as other outpatient treatment models. And we have a harm reduction program at our Bishop Walker ambulatory care site.
Does that answer your question, Doyen?
It does, thank you.
Thank you. Is there anyone else who has a question for Ms. Brown? I just want to make sure if I haven't seen you, just please unmute your mic and ask your question.
Okay. You muted it?
Okay, I don't think anybody else has a question. Ms. Brown, I just want to thank you, and Community Board 9 wants to thank you for joining us this evening.
Wow, I came just when she finished.
Oh, good. So Ms. Leopold, do you have any questions?
I don't have any questions because I didn't hear.
No.
I didn't hear it. I will listen to the recording because I'm just finishing on the other side.
Yes,
with,
please do.
Assembly members in the man.
Very good. So Ms. Brown, you're welcome to stay, but I know your busy schedule and we thank you again for joining us.
Well, Enid, I would love to stay because I want to hear, I know that one of the community board members mentioned something about services for our elders. So I'd like to hear a bit about, what she had in mind. And frankly, I just really would like to hear any of the other, issues that get presented, because you never know, there may be something that we can help out with in the future.
That sounds
So
great.
if you don't mind, I'll listen in.
Please do. Ms. Leopold,
Yes.
I'll throw the meeting back to you then.
Thank you. Thank you so much, Enid. Thank you, Mia, so much for helping out. And as I said, that when you become part of this committee, you become family, right? So you are here and we are family, and then we are doing this work together. It is not Community Board 9's work or Fran Leopold's work. It is our work, our community work that we have to do for the community. So sometimes I just pass on the baton to someone to just lead out the meeting. As long as you have the agenda, we could lead out the meeting and we will do this together. As you look at your agenda, you see that we have seniors program. And just when we were starting, I know that I heard someone said that they were from, I think it was Diane, who said that she wanted to give us a short presentation as to what her organization does in the community. So go ahead, Diane, and then I will continue on what we are looking to do for the seniors. And I think Albert said talk about something as well. So go ahead, Diane.
Thank you so much. I just wanted to share that on November 3rd, which is a Friday, from 11 to, I believe, 3, we will be at the Flatbush Y here in Brooklyn. And we're going to be doing a Senior Appreciation Day. On that day, we have a healthy eating specialist coming in to prepare a dish for the seniors and share with them how to, and serve it up like they do at Costco's, a little small portion of it. And we're also going to have some people coming in who are going to donate fresh produce. And it's our goal to tie the recipe in with whatever fresh produce we get, and just share the day. And there will also be activities that are always ongoing at that Y. And one of them is an aerobics class. And when we're doing the walkthrough, the aerobics class was going on. And I got tired just sitting there listening to the seniors working out in the room next door. So just so that there are so many things that are out there available for our seniors. And we've contacted some of the agencies that do have older, use the right wording, older adult activities to show respect. And so we're going to have them come over and table and share with the community. And Aetna has partnered with us for this as well. And they're sharing information about Medicare. And so we're going to be there on November 3rd. Our flyer is still in the works because we're still finalizing some pieces. So as soon as the flyer is finalized, I will share with Community Board 9. But this
Miss Smith, I would be so honored if you can become part of our community partner, be part of this committee. And because you work in the community, you're in the community, you're doing stuff with the senior, and I will be ecstatic, I would be happy, I would be overjoyed just to have you on board because of what you are doing. I just, August 25th, I hosted a seniors party for the seniors at Kings County Hospital. Aetna was so grateful to host it. So we had massaging, so they came to get the massages. I was ready to get facial, but because we did it on a Friday, so we were not able to do the facial. We had haircuts for the men, we had a massage, and we have a pedicure, the manicure, and then the persons, even the men went and they put on nail polish as well. You know, they were just so happy. They were just sit down, and then I was like, hey,
awesome.
it's too bright. Go change it and put this color. It was just so lovely, you know. And then we had a health segment where they did the exercises, and then we had a young lady who did the laughing yoga, which was just so awesome. The laughing yoga. I'm like, so we had the nurses and the some of the hospital staff. They stood on the side and they partake in what they were doing. It just like awesome. So we had food from them. We had breakfast for them in the morning. They came and they had the breakfast, and then we had the infused water. So we had all the fruits and everything in the containers. They had the waters drinking, and then Aetna, then Miss Love, right? Jacqueline Love, she brought all the lunch for us, and in the evening time, we had a movie for them. And then Aetna came in and they did the popcorn and everything, and then they were like, when are you doing this again? Are you doing it next month? I said,
I would love to connect with you because I love to build them. I love us to build something together. So awesome for the older adults. Okay.
Yes. So definitely. And council member Rita Joseph, she came, she sat, we had bingos. So she played bingos, and I think we had prizes because the hospital provided prices for them. So whoever get the bingo, so we give up about 6 or 7 prizes, you know, per person. So on the bingo. So, and we know that our council member Rita Joseph, she's very much involved in the seniors.
Right.
And then
she's done some stuff with us too.
Yes,
she has.
So definitely. So I would really like us to partner, because that is one of my other things, the senior programs that we're looking, because this is almost the end of the year. And we are looking to do with Friends of Brooklyn CB9 to do some fundraising, so we can have some money so that we can. I'm looking for us to take them to a Broadway show, you know, and then for Broadway show with lunch or whatever, if brunch or that we can take them, because we know they had already chosen the shows, but a lot of the Broadway shows are closing down now. So we're gonna you will choose again. We have to revisit that the drawing board to choose, give them 3 options of Broadway shows that they want to see, but it has to be paid for. So we'll be working with the council member to see, to pay for it, so they can either have lunch and then go, brunch and go, or then they go and afterwards they go for brunch, and just have a good time. So there are so many things that I want to do for them, I want
Sign me up, please, sign me up.
So this is the next thing I was looking to Albert, I think that you were saying something. Albert, is there anything that, because I know that you are into this as well, is there anything you want to share with us?
I will. What I wanted to share sounds very relevant to your conversation. It sounds like something that I would really be interested in partnering up with both of you or anyone else who is interested. As a health benefits advisor, throughout the year, I cater to the different programs, et cetera. Now, from October through December is the Medicare open enrollment period. For those of you who are aware, people I'm dealing with really are very confused. And what I provide is an educational seminar. I'll speak, I'll present for about an hour, and something that like I said, I do throughout the year in my community, and I'd love to be able to spread it out, to everybody in the surrounding area. And I can partner with one of my carriers. It would be Humana, and they would be sponsoring it. They would cater it, come, do the presentation, and it would like I said, it would be an educational event geared towards senior knowledge.
Yes, definitely. I am pumped up. I am happy. I'm looking forward to that, because we have to bring more education and more health awareness to our older adults, because we also have to bring in persons who can talk to them about the finances, because sometimes, they work so hard, and then in a matter of time, the little money has just been taken away from them or just been spent unwisely, and then our seniors, I don't think that they should be at a place, our older adults should be at a place where they have to be spending money for healthcare. They should be getting the medication free. They should be getting all this stuff. I mean, if for any reason that any money has to, any copay, it has to be very small.
Minimum,
so we are looking for programs where they can really, then even with the One Brooklyn Health, they have this wonderful at Pierre Tucson, the diabetes program going. And then we know that diabetes is, when we had during COVID, Miss Enid, she organized, and we had healthy cooking and COVID. So we had somebody who was doing live cooking on Zoom for us. And person was so happy. I mean, we were on Zoom and I was smelling this.
We're waiting to do it again, Miss Leopold. You got to tell us when you're ready.
Yeah, so we're gonna do that again. And then we had a doctor who came in and he did a lecture for men on when it comes to diabetes and stuff. So it's something, we don't have to do everything because it's getting cold. We don't have to do everything in person. Some things we can do in person, some things we can utilize the board office to do it, and some because we don't really have the space. Carroll Gardens, we used to use it before. Maybe media can give us a little bit more on that and how we can use it, but then some we can do it online. But I really want to engage the older adults community, and just bring them together and let them know they are not forgotten. There are persons who care about them, and we want to do so. So we can have social events for them, social gatherings for them. And I'm like, you were saying at the Y, and if we said, okay, some of them will be the precinct, the 71st precinct, they are very good. And if we want them to just transport the older adults, they'll transport them. They'll go take them and let's say they have to go to the Y and take them there and then take them back, So let us do it. I'm happy for this. I mean, we had a great team before, but the team is changed and we have a new team that just come on in it. Is still there as who've been there with us. But then I'm looking forward for us to do so much more and just everyone, just bring your ideas to the table. Let's put it together and let's make it happen.
Okay. I had some ideas that we had thrown out there when we were coordinating this event, but we just didn't have the funding for it. So maybe through partnering, we can do something wonderful.
Yeah, definitely. We partner with the council member we can talk to the assembly member, Cunningham, you know, and we can get something going.
Mhm.
You know,
Mhm.
and then I know that Albert might, you know, have some ideas where we can get a few dollars, you know, and then, you know, he might be able to encourage us and let us know, you know, because sometimes we may not have the monies, but we may be able to get organizations who can sponsor us, you know,
Mhm.
and get get the things going. So I'm quite pumped up. Lady Brown, would you have anything to say? Would you like to share anything with us?
Sorry. Well, I was really getting really excited about all the ideas that both of you were talking about, and also the point that was being made about hosting informational forums around Medicare, as well as Medicaid, frankly, because with the changes in terms of the COVID emergency policies, a lot of people who were on Medicaid during COVID may very well be losing that benefit. So frankly, I was about to send Enid a note that says, sign us up for hosting the forum, educational forums on Medicare, partnering with Humana, partnering with the different insurance firms. I think we could provide the space for that, and even some of the, you know, the getting the notices out for members of our community, as well as our patients. And as was said, it is very confusing, the Medicare rules, and so as to what people should choose. So one, I think we can be helpful in that area, right, Enid?
Oh, definitely. I was making a note about that myself.
Right.
Yeah,
And
yeah.
in addition, to your point, and thank you for giving a really nice commercial for our Pierre Toussaint Health Center. There are many things that we could do together with the respective organizations for our older adults around just all of the healthcare issues, the screening, you know, screenings and cancer screenings, as well as the diabetes, our diabetes center of excellence. But, you know, we provide dental care, and oftentimes, you know, dental services are hard to obtain on the part of our older adults. So there are many things, and I would say that working with Enid and some of our other team members, we could literally identify, you know, over the next year, 2024, what we could be doing, you know, several times during the course of 2024.
Definitely agree with Ms. Brown, Ms. Leopold, even as it pertains to BMI, obesity, and health coaching.
Right.
That's a valuable session also relative to diabetes, but also just lifestyle. So yes, to Ms. Brown's point, we can certainly work with you, Ms. Leopold, as we always have, but on a more robust effort and more specifically in these areas.
Yes, definitely so, because you know, sometimes because during COVID, I mean, that were older adults, they suffered food-wise. Shani or the audience, give me 1 minute, let me just say this, and I will definitely take you in a few. They suffered because food was being sent, and I was targeting and trying to get in touch with all the senior centers in our communities. And then they said, well, they have been taken care of, the food have been sent to them, they are getting food. But then when I started investigating and I started checking to see what was happening, I realized, yes, food was being sent to them. But when the food did arrive to the location, especially those who are living in apartment buildings, they were not getting the food, because when the food was being delivered to their homes, the persons or the super or whoever, the doorman would not let, because of COVID, they would not allow the people to enter. Now, some of those persons now, they had some sort of disability that they couldn't go downstairs to get that food. You know, so the food was downstairs and the food never get to them. And the second thing is that some of the food that they were receiving, it was not conducive to their health. Some of the food was very salty and whatever, they couldn't eat this food, you know? So we have to do better, and then we have to find a way. So if any tragedy, anything should strike, should come our way, that we have a better way to reach them, you know, to provide the food that is needed, that they can get they could not get the medication, that they can, what can we do to get the medication for them? you know, that the medication is sent and whichever location that there was an organization in Brooklyn that some persons used to go pick up the medication and take it to them. But you come up at a time where seniors became very, you know, concerned because there is a stranger coming to my door. I have to open my door to that stranger and I don't know what could happen. You know, so we have to put plans together and work things differently as to how we can meet the needs of our older adults. It could be socially and find ways that we could support them emotionally as well, because I'm telling you, we think that they don't have mental issues. They do have mental issues with the things that they are going through. You know, so we have to look at the different areas where we can meet their needs. Shani, I always murder people's names, so go right ahead.
Not a problem at all, Ms. Leopold. It's a pleasure to be here, especially Ms. Brown. It's a pleasure to be on the call with you. I'm from Live On, New York. I've joined the meeting once before, several months ago. Live On facilitates organ, eye, and tissue donation for about 70% of New York State. I just wanted to also add, kind of in the same vein of the discussion of making the program that you were discussing more robust. I think adding a session or some information on end of life planning for, you know, your members would be very, very key. One thing we are finding in communities of color is that we are not prepared for end of life. Nobody wants to talk about death. And, you know, especially when we start, you know, when people here Live On New York and organ donation, they immediately throw up the hand. They don't want to, you know, they don't want to talk. Oh, forgive my camera. I apologize. You know, they don't want to talk because they think I've got a cooler under my table to take their organs. But that, you know, it really is a serious conversation about saving lives. We are also championing healthy living. Our new CEO is very much aware that there are millions of people heading to the transplant wait list that don't need to be there. If we could just get people healthy, how many of us know someone that has diabetes, hypertension, you know, or just leading a very unhealthy lifestyle? I was just diagnosed maybe 6 months ago, my daughter and I both, as pre-diabetic. I've been trying to take steps now to do better, but how many of us are on that road? You know, so we are definitely working with organizations that are pushing information about healthy kidneys, healthy living. We are also working with some elected officials to put together programming centered around end of life planning for these target communities. We also get folks registered to vote. We do, you know, Live On New York is multifaceted. We do a lot. As a matter of fact, Ms. Brown, we actually wanted to put together an appreciation event for Brookdale. If you have any time to chat, I'd love to speak with you offline about putting that event together. I was unsuccessful with reaching anyone to get it planned. We've done it for several of our partners that have been doing amazing work in the organ donation space. And Brookdale was one of those hospitals that really made strides in improvement in saving lives in that arena. And we just wanted to really recognize the work, formally recognize that work that you guys are doing over at Brookdale. Amazing work. But I would also like to be make sure that Live On New York is a part of this program that you're putting together. We also have a partner, End of Life Choices New York, that we partner with frequently to put framework together about end of life planning. They're amazing. So please, Ms. Leopold, Ms. Brown, please keep us in mind. Ms. Leopold, if you could put your information in the chat, I'd love to shoot you an email so we can connect.
So you can connect with the board office and they'll give you and my email should be part of the but then just because we don't have a chat on this
I tried and I tried when when I joined your meeting the first time and I was not able, if I drop my information, oh, there is no chat.
No, there's no
I
chat. So
forgot you just said
Mia, so Mia is on.
Okay.
So yeah, so you can call the board office and then
I have the
Mia,
number. Again, maybe I called the wrong number. I wasn't successful.
Mia, can you give her the number? Can you because everybody knows the number. Can you give her the number, please?
Sure, it is 718
Uh-huh.
778 9209.
I got
And the
718
778 9279.
9279.
Correct.
Okay.
Yeah,
And
so you can call and Mia will give you my information.
awesome. And Miss Brown, is there a way that I can
Yes.
reach you?
So my number is 718-613-4001. And everybody can have it.
Okay, so that's 613-4001.
Yes.
Okay, I will.
Yeah, and Dion,
definitely-
Dion, can you just write make a note of Miss Brown number as well in the
That's
minutes.
718-613-4001.
Thank you. Noted.
You're
Miss
welcome.
Brown, absolutely amazing work that you are
Yes,
doing.
that is
Absolutely
great. But we have more.
amazing work.
I hope I'm meeting people that's to be. Let me hold on a minute. Let me see. Hello, James. James. Because I don't know when the last time we had our meeting and then we had a really bad experience, and I'm afraid to admit anyone. James, are you there? Hello? James, if you can hear me, please unmute yourself and let us identify who you are, please. If you cannot do that, then you will be removed. Okay, Mia, can you remove James, please? We had a really bad experience the last
They've
time.
to have unmuted themselves. I don't know if they're having an audio issue. James?
Okay.
Okay.
So we are looking forward to us collaborating together, working together. And I know that Dion she's putting I think she have already set it. Dion, go ahead. Go ahead.
Yeah, can I have the last four digits of Miss Brown's number again? Missed it. So 718-613.
4001.
Thank you.
You're welcome.
Okay, so Sandra, would you let me hear from you because you spoke, but I didn't hear before we go. I don't want to keep you guys for too much longer. I know you said you're a community member, right?
Yes, I live in Community Board 9. I'm a resident here for 38 years. I am a member of a organization called the Organization of Public Service Retirees. I am a retiree. I worked for New York City Housing Authority for 30 years. So currently I'm receiving all of my benefits from my civil service and public service, as well as Medicare, which came up several times this evening. So that's very interesting. Many of you may have heard that recently, over the past few years, public service retirees have been in court battles to keep our traditional Medicare, because the city administration has decided to balance the budget by taking away traditional Medicare and forcing us into a Medicare Advantage plan. So Medicare Advantage plans traditionally do not give the same benefits as traditional Medicare. So we would like the Community Board 9, and I came to this committee first because it's all about health and social services, to sign on to or to support us by doing a resolution to ask the city council members to pass legislation so that the municipal city employees, retirees, can continue with their Medicare, their traditional Medicare. So we won 2 court battles already, and we want to codify into law so that the city cannot take that benefit away from us and force us to go into the Medicare Advantage plan without giving us a choice. So we have a draft.
Hold on a minute, Miss Mia, we have 2 persons waiting. Can you see who they are, please? Because I don't want to admit them.
One of the people that entered, it was simply James, who I put back into the waiting room. And the second person, I'm not sure who that is. I would have to let them into the room for us to figure it out.
Okay.
Yeah.
Okay.
Sorry for that.
Yeah, sorry. Yeah, go ahead. I'm sorry, Ms.
Yeah,
Andrew.
so just basically, as you may know, for-profit Medicare Advantage plans, they're for-profit, and they're cheaper, but they are very disruptive to retirees. And the truth is that the private plans have denied life-saving patient procedures, rejected much-needed medications, and it actually increases taxpayer costs.
Okay.
So we're asking to partner with the Community Board 9's Health Committee so that you can support us by a resolution which has already been drafted. I can get you a draft copy of the resolution. There are other community boards throughout the city that have already signed on to support us in this endeavor. And we are asking that your committee also sign on to this resolution to help us keep our traditional Medicare. As has been discussed throughout this meeting, health is so important to seniors. I'm a senior now, and I don't want to lose the right to have more autonomy and authority as with my healthcare. With the Advantage plans, it's for profit, so they can choose their profit over a medical procedure that I may need. We've already won twice in court, and we're hoping to be helped by community boards as well as the city council persons to keep our traditional Medicare. And I can send you all of the documents. I could send you the draft resolution and speak with you personally.
Yes, so please send me the draft.
Do you have the resolution number? Sorry to jump in. Do you? I feel like I'm
the city
looking at something.
council.
Do you
The city
just have the
council. I'm
number?
sorry, I was speaking fast. The city council. It's the city council law that we want passed is 1099, and city council member Charles Barron proposed it. We have almost half of the city council members that we need to codify this into law, but we want the community boards to let them know that this is essential and that you're supporting us as the other community boards throughout the city has.
So what I would like you to do, if you can send it, that resolution to the board's office, and then they will get it to me, because we will be having our executive meeting. So when we do have our meeting, then it will be presented. Right.
Okay, I'll do that.
Yeah.
Definitely.
And when we are having based on what we have to take it to the entire board for vote. Right. You're right. So then I will just, do you have, when you send that information to the board, give them your contact information as well, so I can reach out to you.
Okay.
Because we would like you to be present at the general membership meeting. Absolutely. So that you can present it. Okay.
Absolutely. Appreciate that. Thank you.
Yes. Yes. Thank you. Thank you for coming. But at the same time, even after this is happening, you live in the community, and based on what I know that you have the well-being of the older adults, you know, at heart. So I would really like you to be part of be a community partner, be a community, you know.
Yeah, all of the things I've been hearing tonight have been very interested. I'm interested in a number of them. So yes, I could definitely stay on the committee.
Yes, definitely, because I would just want Miss, what's her name, from live on New York. I just wanted to I hear what she was saying. Yeah, I mean, I'm from the Caribbean, and when I went to get my citizenship, this day on the paper it has, would you like to be an organ donor? And when they said so I was like, should I click yes? And so I went ahead, I said, yeah, I clicked it. And I came home. My sister, no, but you ain't had a thing yet. I had sleepless night for weeks.
Oh,
my sister's like, what, Fran? Because everybody called me Fran, right? He said, what, Fran?
You click yes, girl, they can kill you.
You,
They were
Ms.
like,
Leopold, that is what everyone believes. And I grew up in a Trinidad household. And that is what everybody believes, is that if you sign
yes,
up, they're gonna come and get you.
yeah. They
I
said, girl,
promise it
when
doesn't
you go
work
to
that
the
way.
hospital, you go to the hospital, if you get sick, in no time you will be dead because they want your organ. And I am telling you, my inside, I said, why did I do that? Why did and how many years now?
I hope you're still registered.
How many? Oh yes, I am. How many years now? Mia, those persons are they still in the waiting room? You don't know who they are, right? There are 2 persons waiting in the waiting room, and I am very.
Yeah, we've had that prior activity with the Zoom bombing.
Yeah, I'm very
I find
afraid.
that most people who are interested in attending these meetings are here within the first half hour.
Yes, and those people, so they can stay there, sit there. Yeah, yeah. So that was my big issue with that, and then Miss Sandra, I'm happy that you're doing that because I just turned 60 on Tuesday, and in 2 years I'm looking to retire, so I really want to get my money.
You want to get your best benefits.
I want to get my best benefits,
Yes,
So
exactly.
I am with that, and there are so many other persons who they don't know, and they so they're just getting the rough end of the
Exactly.
wagon. Yeah.
Yes.
So anything that we can do to just bring some comfort and just have persons to just you're not gonna get 100% of comfort, but if you can get 85%, that's good.
Exactly.
We'll take that.
Exactly.
Right? So anyone else, because it's already 8:16, I don't like to keep people for too long, especially when you have to go to work tomorrow. Anyone else have any comment? I am so ecstatic to have Ms. Brown. Ms. Brown, you are welcome to join us anytime you want to. Since you come here, you are part of the family, so you could join anytime. Any suggestions that you want to bring to the table that we can just work together and make it happen. And as you have suggested that you can even host us. I was just at the ballroom on was it Friday? On Friday that the cancer event that they had. This is the second time that I've been there, and it was just awesome. And then last year, was it last year or the earlier year, they had graduating those young persons who did the diabetic training.
Yes, yes.
So so there are some great things happening. And if each one of you are bringing something fresh, something new to the table, and we can just put everything together and have some really good, should I say, mealtime or cook-up? In the cook-up, you put everything in there, right? So you're gonna have some really good cook-up and eat something really good and just feel good and how what we bring to the table, and just we are not only helping the community, but we are helping ourselves too, because it makes us feel good and we are giving back to the community. So I just want to take this time. You are a family. Thank you for being here. Thank you for your time. You can also, because since we don't have a chat, Dion, she's putting together the WhatsApp messages so that anyone who we could communicate outside of meeting here once a month. We can just throw in something in the WhatsApp. So just reach out to the board office. Mia give the number. Reach out to the board office. Say, hey, I was on the meeting and I want to be part of the chat. So just give your information, and then she'll forward it. She will forward it to she'll forward it to Dion, and then Dion will make you so we can have a list, and then we are able to communicate. So anything that come up, any suggestions, say, hey, Fran, let's do this together. Hey, Leopold, let's do this together. Let's do that, and let's do this. We're gonna do it. Okay. So just remember,
Miss Fran.
Yes, yeah.
Miss Fran, I want to add something to the cook-up rice. Just one thing. This is Enid from OBH. So on October 25th at 5:30 p.m., Pierre Toussaint will be hosting a breast health panel that is in partnership with East Flatbush Community Partnership. So Ms. Diane, that's something that we are doing with East Flatbush Community Partnership, as well as SHARE. SHARE is a breast cancer awareness group. You can find more information about it, since we do not have a chat for me to share it with, on onebrooklynhealth.org in our events section. So we really do hope that all of you can join us on that day. Thanks, Ms. Fran.
Yes, Ms.
Yes, you're
Enid, my
welcome.
apologies for not sharing that. I'm getting ready to go out of the country and that wasn't on my schedule, so.
Oh,
I'm
that's okay, Ms.
sorry.
Diane.
My
Next time, we hope to
apologies.
see you next year.
Okay, thank you. Bye-bye.
Yes, so thanks each and every one of you. Have a pleasant evening. Stay safe, stay warm, and hoping that each one of you here, there are 13 of you online right now. Well, I will say 12. I'm not including me and myself, 12 persons. So I'm expecting the 12 persons, which include, well, I should remove Dion and was my other, and Naisha. And then give your names, call the board, send an email, give your names and be part of the team. And let's make this thing happen. All right.
Yes.
Have a good night. Thank you, Ms.
Great,
Brown,
thank you
for
so much.
coming.
Good night,
Thank you.
everyone.
I'll be
Wonderful
Thank you
meeting.
listening
all.
to
Thank you,
the
everyone. Good
presentation
night. Be
because I
safe.
didn't get
Be
it, but I'll
well.
be listening.
Bye-bye.
Thank you all.
Good night, everybody.
Good
Good
night.
night.
Thank
Good
you
night.
so much for sharing. Good night, Mia.